Jump over to Speaker Therese Terlaje, the health chair of the Guam legislature. Good morning, Madam Speaker.
Good morning. Good morning, Chris and Sabrina. Good morning, KUAM, and good morning, Guam.
Good morning.
I don't know if you want to just react to our conversation we just had with Dr. Cabrera before we get into all the other stuff.
Well, I'm glad you had him on to answer some of those questions. And I'm glad that the last caller called in, because I think that's where most of the people that I've been talking to are concerned, right? We want to get to, I think the people of Guam are still very willing to help stop the curve of this, stop the spread of this virus. And that we have seen them completely willing and going to extremes to help us in this effort. And so I think we need to recognize that, and we need to keep them, on the same page with all of us as we move forward. And so one of the most important parts of the information to me is that if both vaccinated and unvaccinated are able to spread the virus, we should treat that accordingly, right? We should all act accordingly. It should be very consistent in our messaging, and it should be consistent in our mandates, and it should be consistent in how businesses operate, how government operates. It has to be clear and not any contradictory messages. Yes. So I'm glad that last caller called, and I'm glad that Dr. Cabrera was able to give some additional information.
Yeah, a lot of times it's really hard to just put all this stuff together from like a logical standpoint. So we definitely appreciate him coming on and kind of like telling the lady like, yeah, that's really valid, because I feel like it's huge. It's huge. Like we need to put out these positive cases. I mean, that's to me the root of everything. Everything starts from the positive cases. So I don't know why
and despite our fantastic vaccination rate, that it's spreading. And so, we can't blame that on one part of the population. Are we going to blame it on the kids? When the kids start getting it? No.
Don't even, Madam Speaker. You better not.
I'm telling you, I'm feeling really very badly for the kids, because we were hoping to protect them from this by getting, vaccinated 80% of our population, but it's looking more and more. I don't know. I hope I'm wrong, but it's looking like they're not sufficiently protected, and we need to take all the measures that we can to protect them.
Yeah, definitely.
Yeah, my child's not eligible to get vaccinated, so I'm just worried every single day I send him out to school,
because it's out here in the community.
And we've disrupted their lives, and we put them back in school. Now, I think they're fearful, and of course our whole population is fearful. I'm fearful. I think that this is I agree with Dr. Cabrera 100% that this is a very serious time for us, right? That we cannot underestimate the number of cases that we are having. We cannot underestimate the fact that our hospitals are full, and that these are with the current COVID cases. We cannot, we've seen the news that they're moving cases or patients from GMH over to SNU. Already, they're trying to make more space. I want to see that everything that we have put our money into, or our planning and our money, that those are coming to fruition. That we're pulling those out. We're going to take care of the population, and to the best of our ability, we're going to give them the treatments that we have available to us, all of it. And but I think that the people of Guam also need to know the truth. They need to know, what is our capacity, and exactly, how many more ventilators do we have available? How many more people can get that sick? How many more people, do we have space for in the hospitals before we start turning back to, the tents or whatever else we have available? I just think we need to remind everyone what we have available to us, and how we are going to be able to take care of them, and what our limits are. And I think the people of Guam will act accordingly. I think when they were told that once one of your family members gets sick and you're not able to contact them anymore when they're in the hospital, you can't be near them, it's a very painful experience, and no one wants to go through that. I think they'll act accordingly. And I think if we know for a fact, and I'm so glad Dr. Cabrera, reasserted this, that if we know for a fact that vaccinated people can also spread the virus, that we should act accordingly. And that should be the consistent message everywhere. And and I think that's how we will help to curb.
Yeah, but that means they're going to have to come out with another refined executive order, and that's going to be 2 in a week, and it's just going to further. I'm still getting messages from people, Madam Speaker, who don't know that there was a refined executive order. They're still going by the one that she came out with Friday. So you're right. The caller was right. Dr. Cabrera was right to say that it's valid, and I mean, he said it's something they're looking at, but it's kind of late in the game. It's 8 o'clock. We're going to jump over to KUAM TV. Madam Speaker, can you hop over with us and we'll talk budget and stuff? We also got Chima Mbakwem to go through a lot of the new positives, as we had 126 reported out from the Joint Information Center last night. This is the link. Superintendent John Fernandez coming on here this morning. Will the department pivot in any way, Bree? As we've been interviewing and, speaking with just a lot of parents who are obviously very concerned about the community spread and the positive students. I think we're up to, 44 school cases?
For GDOE.
GDOE.
These are students. That's not taking into account staff members.
Right, yeah. So we'll see.
And if I may say, the teachers, the principals, the aides, they're all working really hard. And I think that's also a concern. I mean, they're working all the time, trying to keep these children safe. And so I think that, it's not a matter of them doing that. It's really just a matter of there are a lot of kids together in the schools.
Yeah. I just got a call.
None of the capacities have been changed, right?
Yeah,
We've got back to full capacity. Yeah.
I mean, I just got a call this morning. A guy at JFK said, hey, you guys got to go around in the morning and you got to see how overwhelming it is for the school staff to try and mitigate the mask, the social distancing, all that stuff. It's 8:01 again. Let's jump over to KUAM TV. We are on the breeze right here, KUAM FM, Agatni, Guam. This is the link. Good morning. Got to make it short because there's a lot going on. It's 8:01 Pacific Points. Calvo Enterprises, IT&E, Jack in the Box. Proud to present this episode of The Link. It's Wednesday, August 25th. Coming up, we'll look at news. We got Chima Mbakwem breaking down the new positives, clusters, all that stuff. We've also got GDOE Superintendent John Fernandez. We'll catch up with Mary Rhodes. Are there more amendments in store? More refinements? I like how Dr. Cabrera said that refined EIO with a straight face. It was kind of funny. Tato 2, we're jumping back in with Speaker Therese Terlaje of the Guam Legislature. Good morning, Speaker.
Good morning.
So the budget, I guess we talk about the budget.
Sure. So a budget's proceeding. We're facing an August 31 deadline, trying to get this budget passed by then. Of course, the new year, fiscal year doesn't begin until October 1st, but we're trying to get the budget done by August 31. So several things going on. First of all, there are several excellent parts of the budget where I think we are going to be seeing improved services and, because of budget measures that have been put in place, more targeted. But we're also seeing, of course, we have not seen the ARP plan, so we are still making a budget for just a portion of the money that's really available to Guam, and trying to predict what these agencies are going to be able to do for the people of Guam without that $600 million being put on the table. The other thing I've been making some amendments on the bill. One of the ones I've been trying very hard to pass unsuccessfully to this point is to increase the provision for tax refunds. I'm afraid it's too low, that we are not going to be able to pay, refunds quickly as we could. And I think this is one of the years that it's very, very important to do that. While PUA has ended and we're not sure of what additional direct assistance these people will be receiving, that at the very least, we could give them their tax returns back to them as fast as possible. And we have processed yet waiting for payment returns, at least $20 million. And I want to get rid of those as well. I think there's no reason for us to owe anybody. The government of Guam now has cash, and we should pay all the refunds as fast as possible. And we should make sure that there's enough cash set aside throughout the year so that we can continue to do that. This is the year to do that, and this is the year that people really need it. I think, Chris, you'll be happy to hear I also made an amendment yesterday to the UOG budget that restores the funding for scholarships back to the priorities that were supposed to be set, including ProTech, for doctors, nurses. We want teachers. There was only one teacher scholarship that was funded in 2020. And, we have a drastic shortage of teachers. So all of those things that prior legislatures before us had recognized to be the priorities of how, we need to fill these positions, and we want to give scholarships in order to attract them and retain them in these programs, that I'm hoping we're going to be able to get back to those priorities and fill these positions. Nurses, doctors, teachers, especially those. Social workers is another one, right? But so otherwise there are other amendments being made to the budget, and I think the amendments are improving the budget, but there are some, I want to give, commendation to the chair that there are some provisions in this budget that are actually going to make things better, I hope. Yeah.
I wanted to follow up on the meeting that the Democrats had with the governor prior to the override attempt of the veto of Bill 11. Can you tell us what was that meeting all about?
It was about the mandate, pretty much. We were concerned about the mandate and the issues that had been brought up by GHRA, especially that they did not have time to implement or train their personnel for these types of mandates, and whether the mandates were in contravention of what the PAG had said, Physicians Advisory Group, and just that. But more importantly, for me, is particularly, I wanted to make sure that if we are going to put these types of mandates on people, that they are actually directly going to assist us in achieving the goal that we're going for, right? And if the goal we're going for is to stop the spread of the disease, then I want to make sure that it does that. And I think we discussed this earlier about whether unvaccinated versus vaccinated, they both spread the disease. They're both carriers. And so I think the people should be treated accordingly, that we are all potential carriers, and that there's no class that is exempt from being carriers. And, I've been in rooms of doctors and leaders who take off their masks and say, well, we're all vaccinated, aren't we? And I don't think that should be done, right? It's inconsistent with the message that we're trying to make. And that is, we need to stop the spread. That means we need to continue to wear masks. We need to continue to sanitize. We need to continue that if businesses are going to operate, that they all operate with the same, rules. If we have establishments that can't follow the rules, let's close those down. Let's not close down the establishments that maybe the data does not show are leading to the spread of these infections, right? I think that's one of the things I really have always tried to get, and that's through, we've had so many oversights of public health. We want the data. If we can't get the data, how do we know that the decisions are being made based on data? And so that's what we wanted to clarify. What is the data, and what is the data as to how the virus is being spread on Guam? Is it just certain businesses that are not complying? Does the mandate affect the businesses that are not complying, or is the mandate affecting all businesses, compliant or not? And that's why I want it to be targeted. I agree with Mayor Alec when he was on a couple of days ago saying we need a plan, and we need, if we are going to be expected, that everyone has to implement the plan, the more time that they can get to implement that, the better. Mm-hmm. But I do agree with the governor full-heartedly that we are in a critical situation, that we have to stop the spread of this virus. We are at very great risk of overwhelming our hospital. We can see right now that they are being, that we are always on a very fine line between, full capacity and overwhelming our hospital, our healthcare professionals who've been at this for so long, and that I think the community will act accordingly when they are given that information, right? Give them the information, they will act accordingly.
Right.
Tell them the capacity of the hospital, how many ventilators you have left. Tell them what's going to happen when you're hospitalized, that you're going to be separated from your family. And we have seen them act accordingly, that they're going to take extra precautions. And
So
tell them very clearly that vaccinated people can spread this as much as unvaccinated people. And that's the mixed message I do not want. I want it to be very clear. If that's the case, then that should be clear, and we should all take those precautions.
So did any of your colleagues from the Democrat side of the legislature raise their hands and say, look, Gov, this is not fair. We're only targeting certain businesses to implement this vaccine mandate. You didn't hear from GHRA, you didn't take the advice of the PAG.
Well, that's what I'm saying, Bree. Yes, those are the concerns we brought to her, because we were concerned about.
What did she say?
I'm glad that she revised her mandate. Let me say that, and I'm glad that the mandate was revised to include how we're going to treat private employees versus government employees. For example, if they have to be vaccinated, and they can't be vaccinated, that they can get tested instead. That's how we're treating government employees. So I am very glad she took one of my colleagues' recommendations to that should be how we're treating private employees if we have to do that. But my concern was that I wanted to make sure that we have the data, that we are targeting businesses based on that data, and that we are targeting vaccinated versus unvaccinated based on data. And so the data shows that both of them are carriers, and we should be acting accordingly.
Right. And so when you guys presented that data, what did she say?
And that we should, we're asking her to present the data. The data comes from public health. And so we want public health data as well to be consistent, right? So I know CHIMA's coming up, so that's good. But, sometimes we hear what businesses are causing it. Sometimes we don't. And we're back to this. We've been at this since day one, right? What types of businesses and does public health have the capacity, as they promise, to check these businesses out, to shut them down if they can't comply with the rules, right? To shut those down so we don't have to shut everyone down. Does public health have the capacity to trace the contacts? Right? This is what we've been talking about for months. This was part of our planning after COVID, right? Our revamping of public health was supposed to make us able to deal with surges, right? It was supposed to make our hospitals able to deal with surges. And that's what we want to see now. Are we able to deal with those surges? Do we have the contact tracing capacity? Are we doing that? Do we have, the hospital capacity? Are we doing that? And I'm sure they're working very hard at that. So I just think that's the kind of information that should be shared with the community as well. And if we are able to give GHRA more time, are we going to do that? And one of the, I guess, just little inconsistencies was that it was an immediate mandate, yet there was a September 6th enforcement deadline. So, I just wanted to know if we are able to work with GHRA, that we should do that, because I think GHRA has been a very good partner. They have not been, defiant or belligerent. They have been cooperative, and they have tried to train businesses, retrain businesses, which is a huge help for the government, I think, to retrain employees, to help us to get employees vaccinated, to help us get employees tested. They're very proactive in those measures, so I want to thank them. But most especially, it's the people of Guam, right? I just think the more information you give to the people of Guam, the more you have seen them react. You guys have been part of this. You're the ones giving the information out. And the more they get, they are willing. They are very willing to do what is necessary. And so if they can see the logic in it, so it always has to be logical, tied to the data. That's what I'm advocating.
Do you feel like we're at a point where you need to call in public health and get some of this data in a roundtable or a oversight or?
Yeah, absolutely. We had discussed that about the doctors coming in and talking about where we're at, and public health as well. I think you've been doing a very good job of it in the last few days since the mandate, getting more of these doctors and public health out there to speak.
Mm-hmm.
And so we're able to gather that information as well. And but so again, we have a job to do, and that is we need to curb this virus, and we need to do it in a very targeted way that is going to have the effects that we want.
Yeah.
And so if we realize that all of the people of Guam are potentially spreading this virus, we need to act accordingly.
Is the legislature going to mandate vaccinations within the legislative branch?
I think so far that the Committee on Rules has mandated. Well, I can't remember. I'm sorry, but I know that they are allowing every office to do that, and I know that my office is fully vaccinated. But so they're going to allow that and give the option of testing, of course, for those who are not vaccinated for whatever reason.
Okay.
That's what I'm saying. If that is allowed in the government of Guam, that should be allowed in the private businesses as well. And so that's why I'm glad that shift in the mandate has occurred.
Mm-hmm. Well,
So
hopefully,
that no one loses their job. Yeah.
Mm-hmm, yeah. Well, hopefully you get some of the data that you guys requested from Adelaide.
Well, you've got this data. We want to know, right? So we've seen all the increased cases. We should know very clearly where those came from. And so they say households and they say workplace, right? And, I just think we really need to know when we're talking about workplaces, what types of workplaces, if we are going to mandate that different types of workplaces act differently, right? They should be tied together. And so that's the question. If it's coming from bars, if they're being spread in bars, then, why are we affecting restaurants? If it's that's what I really want. I hope you can get clarification from Chima. And that's, I think, how we target, right? If it's coming from everywhere, then we're not mandating everywhere. We're mandating places.
But you're right. You're
mandating
right.
places where masks come off. So that makes sense to me.
Yeah, but you're right. I mean, we're focusing so much on vaccinations, the 20% that haven't been vaccinated yet, but not controlling the spread.
Well, if you see the hospital admissions from
Yes.
the data last night, there's a higher percentage. I think a higher percentage now of vaccinated people who are being hospitalized, right?
Yeah.
So that's increasing. And now we're talking about children. Yeah.
We're right on the edge, Speaker.
Yeah. Yes.
Thank you.
So I appreciate all your efforts
Of course.
to flush out this information and to get these things clarified. I want to commend you for your assistance in that regard.
Well, if there's a legislative resolution in the works or something, we wouldn't get
Oh my
something to hang
gosh.
up back here, JK. Thank you, Speaker.
All right. Thank you.
All right.
Take
Take care,
care.
Chima. I see Chima. Hello. Good morning, Chima. And take care, everyone. Good
Right on. We got to take a quick break, really quick. We're coming back with Chima. We got John Fernandez, GDOE Superintendent, all right here on the link. Good morning.
Looking for TV schedules,